Hi everyone. In this clip, I will be talking a bit about seizures. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, movements, feelings, or consciousness. Seizures can happen once, which is isolated, or repeatedly, which is epilepsy. We have different types of seizures. We have focal or partial seizures, and this originates in one area of the brain, and it causes twitching in one limb, unusual sensations, or even deja vu. The second type is generalized seizures. This affects both of the brain hemispheres, and this in itself has four different types. One being tonic-clonic, which causes convulsions and loss of consciousness. The next type of generalized seizure is absence, which is a brief lapse in awareness. We also have myoclonic, which is muscle jerks, and atonic, which is a sudden muscle weakness or drop attack, they call it. These are all considered part of the general type. And then the third type of seizures that we have is non-epileptic seizure, or NES. And these are mostly related to trauma, stress, or emotional overwhelm, and not caused by abnormal electrical activity. The conventional treatments usually are anti-epileptic drugs, or AEDs. These work by stabilizing electrical activity in the brain. Of course, regular liver and blood monitoring will be absolutely required once you're on this or before you go on this. And some AEDs reduce folate, vitamin D, calcium, and B6, so they increase the need for supplementation. Another conventional treatment is by surgical and device therapies. Surgical removal of basically seizure foci, and also vagus nerve stimulation is another thing, which is VNS, which they implant a device to send mild electrical impulses to the brain. Then there's deep brain stimulation, or DBS, for drug-resistant epilepsy. We have responsive neurostimulation, or RNS, which detects and interrupts the seizures. Holistically, we look at the diet-based therapies, such as ketogenic diet, high-fat, low-carb. This reduces seizures frequency by altering brain metabolism, and it is very effective in children. But in the long run, it may cause constipation, kidney stones, and some nutrient deficiencies. Decreasing sugar amount in your diet obviously is going to be very important. There's also modified Atkins, or low glycemic index diet, which is easier to maintain, and it has much milder effects, if any. Passion flower, which is calming, GABA promoting. This may enhance the effects of sedative meds, though, so keep in mind. Valerian root, which is a mild sedative, anticonvulsant, but if you are on benzodiazepines, you should avoid this herb. Skullcap, which is nerve tonic, but it can potentiate any sedatives that you might be on. Ashwagandha reduces stress-induced seizures, but do not use it if you have hyperthyroidism. CBD oil is quite effective for some epilepsies, but it does interact with AED medications like valproate. Turmeric plus black pepper is an anti-inflammatory, but it will enhance AED absorption. And avoid this in excess if you are on blood thinners. Magnesium complex, which calms the neurons, supports GABA, and the dose will be between 400 milligrams a day, basically. It also enhances AED medication effects. By the way, GABA stands for gamma aminobutyric acid, and it is crucial neurotransmitter in the human brain and central nervous system. It helps calm down the neural activity by preventing neurons from firing too much or too quickly. This is essential for maintaining balance and preventing overstimulation, which can lead the overstimulation can lead to anxiety, seizures, or other neurological issues. GABA supplements, as well as natural sources of GABA, such as fermented foods like kimchi, tempeh, yogurt, and so on, as well as spinach, broccoli, kale, sweet potatoes, and whole grains are quite beneficial. Vitamin B6 or pyridoxine, which is essential for GABA synthesis, around 25 to 50 milligrams a day. Deficiency in this vitamin can cause actually seizures. Too high of a dose over a long period of time can cause neuropathy or tingling in the toes and extremities, which can be reversed by stopping the consumption. Folate or B9 counteracts AED-induced deficiency, and it will be needed around 400 to 800 micrograms a day. Then we have vitamin D3 plus K2 and calcium for bone protection, because AEDs deplete vitamin D. So you would need around 1,000 to 2,000 international units of D3 and K2 and 500 to 1,000 milligrams of calcium a day. And then there's taurine, which is an amino acid that stabilizes membranes. So it would be between 500 to 2,000 milligrams a day. There's omega-3 or fish oil, which is a neuroprotective and anti-inflammatory, around 1,000 milligrams a day. This can reduce actually seizure frequency. There's CoQ10, which is for mitochondrial energy support, 100 to 400 milligrams a day, and it's quite safe with no major interactions. Adequate sleep is absolutely vital, as sleep deprivation can trigger seizures. Stress management is also required, which can be done through meditation, breath work, yoga, and so on, or breathing exercises, and so on. So avoid triggers like flashing lights, alcohol, excess caffeine, or dehydration. Grounding and earthing also can calm the nervous system. On the orthomolecular side of dealing with this issue, we normally focus on restoring optimal biochemical balance in the brain using vitamins, minerals, amino acids, and other regularly occurring substances. So naturally occurring substances, I should say. The key concept for treatment of seizure is targeting neurotransmitter imbalances. So seizures, as I mentioned before, are often linked to deficiencies or dysfunction in GABA or gamma aminobutyric acid, which is the brain's primary inhibitory neurotransmitter. Substances that aim to regulate GABA activity or down-regulate excitatory pathways like NMDA or N-methyl D-aspartate receptor activity are important. Then we have magnesium, vitamin B6, pyridoxine, or taurine. This mineral, vitamin, and the amino acid that can enhance GABA activity and reduce seizure frequency. If the patient has been tested to have B6 deficiency, then they would need between 60 to 200 milligram a day of B6, which is given, keeping in mind that this increases the need for extra magnesium. Suggestion would be to try the active form of B6, which is pyridoxal phosphate or PLP, which is more potent than regular B6. The therapeutic dose of PLP should be in the range of 7 to 38 milligram per kilogram per day. For both forms of vitamin B6, especially at high doses, again, watch for the toxicity, as I mentioned, such as peripheral neuropathy, elevated liver enzyme, and nausea and vomiting, and at which point you have to stop for those to go away. Pharma GABA would be needed between 200 to 400 milligrams a day, which produces anti-seizure effects when taken at bedtime or even in the morning before breakfast. There has not been any side effects reported on this. Magnesium deficiency induces muscle tremors, depression, irritability, and convulsive seizures. So 450 milligrams a day plus vitamin C, 1000 milligrams twice a day. Then we have zinc, which plays a role in modulating neurotransmitters release and receptor function. This is taken 10 to 80 milligrams a day, but do not take more than 15 milligrams a day without consulting your physician. It can cause nausea and all sorts of different things. Then there's niacin or vitamin B3, which can help regulate brain energy metabolism and neurotransmitter balance. The therapeutic dose needs to be adjusted according to each patient's clinical response, but it starts usually with 500 milligrams a day of niacinamide and slowly increasing the dose until its efficacy can be determined. I would not increase the daily dose of niacinamide beyond 2500 milligrams a day, since larger doses can sort of bring about nausea and vomiting. Also, hypocalcemia is an overlooked possible cause of seizures, and they are more frequent in adult cases actually. On the metaphysical and emotional side of this ailment, suppressed emotion represents repressed energy or inner conflict bursting forth sort of uncontrollably. Overwhelmed nervous system, too much internal pressure, fear, or guilt that cannot be expressed consciously. Feeling powerless or trapped, hence the body sort of short circuits from unresolved trauma or feeling out of control. Hope this has been helpful. Like and follow for more. Be the light.